Before we head into the tutorial, I think it's important to really give a basis of what occupational therapy is, because more oftentimes than not, people really don't know. The biggest misconception with occupational therapy is that no one really knows what we do. It's sort of become a running joke amongst many OTs in a clinical or health setting because we've in a sense become the mystery man in hospitals. No one really knows what we do, and when we have to explain it, it's a rather broad career to explain. So occupational therapists have created this motto that they ask, what matters to you, rather than what's the matter with you. This all comes back to, in its simplest terms, occupational therapists help people across the lifespan participate in the things they need and maybe even want to do through the use of therapeutic activities, or as we call them, occupations. So no, it doesn't deal with helping you find a job, it's about helping people adapt to their lifestyle or disabilities. Now, what are occupations? Occupations are any meaningful activity that can occur in everyday life. They can be the role that we play, the environment we interact with, or maybe just the overall activities we engage in every day, such as walking, eating, or writing. When something happens to us, such as injury, pain, stroke, or maybe even a mental illness, it prevents us from engaging in those everyday activities, and that's where occupational therapy really steps in. We look at how to address whatever barrier may be inhibiting an individual from participating in those everyday activities, and we help them adapt their lifestyle and adapt the environment so that they can meet them. Some common occupational therapy interventions that you may see are going to be helping children with disabilities participate fully in school, whether it be cognitively or maybe teaching them how to better close the social gap that may exist between them and other students. Another is helping people recover from an injury to regain skills or motor functions, or maybe just providing support for older adults who may be experiencing physical or cognitive changes. Now, you may be thinking that this sounds a lot like physical therapy, but the two are actually very different, even though you may see them working cooperatively in a clinical environment. To me personally, the main difference between OT and PT is that OT is going to be more of a long-term therapy, and it's going to have more of a holistic background because it's more of a focus on learning how to adapt the environment to meet the person. So since that's a lot of information, just to give a better understanding of what OT really is, we're going to do a short hand therapy tutorial that really shows you what an occupational therapist can do. Overall, we're going to be talking about anatomy, modalities, therapeutic exercises, and techniques. The biggest thing about OT is challenging the patient to regain function or the ability to perform those tasks, while also making sure that they understand why they're doing it. And just to start it off, we're going to talk about the thenar muscles of the hand. In total, 3 muscles make up the thenar group located on the thumb side of the hand. Now, with the thenar eminence being on the thumb side of the hand, they function with the movement of the thumb. They're important for the overall opposition of the thumb, and without them, our thumb would realistically be useless and just unable to function properly for the hand. There's 3 different muscles that make up the thenar eminence, and this is the opponent's pollicis, the flexor pollicis brevis, and the abductor pollicis brevis. Now look at the schematic. You can see all 3 of the muscles and have a better visual understanding of how they all work together to deal with the movement, flexing, and pretension of the hand. Now generally, the most common problem dealing with the hand is going to be a difficulty with the grip or strength that is strongly associated by pain. So a lot of times, patients are going to complain about a lack of strength, which inhibits them from performing daily tasks. Now you commonly see a lot of passive exercises performed, such as the grip strength. Now grip strength, when seen in a clinical setting, is often done wrong because they often just give a dynamometer to the patient and just tell them squeeze as hard as you can. Now a dynamometer is just a handheld tool that has a hydraulic press that is capable of recording the amount of pressure enacted on the lever, but when done from different angles, it can make it easier or harder to grip, altering the results or leading to a miscalculation of grip strength because it gives a mechanical advantage. And that's why it's important to understand how the dynamometer works so that you use it effectively. So for me personally, I like to have the patient sitting with the elbow flexed at 90 degrees, the forearm in a neutral position, and the wrist at a slightly extended and neutral position. As seen in the picture, this just provides better positioning for overall grip strength, but also works better with adults where their hands may be a little larger. The biggest thing with this is letting the patient know how the dynamometer works, because oftentimes you can squeeze as hard as you can and feel like it's not even moving, so you think that it's broken. So having the patient understand that they're gripping without feeling movement is okay. Ideally, you want to test 3 different times in order to gain an average, but you have to understand that this can also be difficult at times because some patients, depending on the disability or the level of pain, can fatigue quickly. And also, when dealing with testing grip strength, you want to measure both hands so that you're able to get a full comparison of what their strength should be. So overall, that's just a little basis of what occupational therapy is and what an occupational therapist can do. And just a very short tutorial of a very common therapy that you will see if ever dealing with an occupational therapist or having an occupational therapy career.